Good morning, everyone. I'm warmly welcoming you. My name is Szilárd, and I'm very happy to open the today's session. This is the Immunology and COVID group from the second year in the Translational Medicine PhD training program. Again, my name is Szilárd, and I'm the Vice Director of Education and Recruitment here at the center. And first of all, I have to start with congratulations and thank you. First of all, congratulations for all the students that could reach this stage. Of course, this was a very long trip, and still there is a lot to do until your PhD thesis defense. However, until now, I think you have done a lot. You have done great. You are here because all of you already submitted the first paper. Some of you have already published it, and you are working on the second paper for your PhD. But again, a big congratulations for your achievements. But on the other hand, also, I'm very grateful, and we are very thankful for you to be here with us, because the reason that we can work is that you are here with us, and you are working together, and you are working together with us on our vision, since our vision is that we want to bring science into the healthcare. I think this is the very clear vision that we want to achieve, and we are very grateful that you are helping us to reach this very clear vision that we are following. Why is it important to have this program, and where did we start? We are always showing this graph from 2016, which is from the Eurostat database, and which is about the mortality in the EU, the European Union. And we can see that in 2016 there were 1.7 million deaths in the European Union under the age of 75, and based on data, we can say that 1.2 million of these deaths could have been prevented. This is a huge number. And if you are looking at the countries, how this is shared, we can see that basically the percentages show that from the total deaths in the given country, which percent could have been prevented. And you can see that still, of course, Hungary is unfortunately on the worst side of the graph, but also the average of the EU is very high, that we could save a lot of lives. So this is very important, and this is why we started this whole program. Previously, there was an old model for doing science. This was basically starting from the research question, and basically it ended when the paper was published, and basically the story ended here. The results did not get back to the patient bedside, and no further questions were asked from the researchers. However, because this model was not the best, we are very proud to say that with the leadership of the Academy of Europe, in 2020, the team from the Center for Translational Medicine managed to publish a new model, which is the new translational cycle, which is starting from, again, as you can see, from the scientific question or from the bedside, and through the proper scientific methods, we can get the knowledge, and with proper communication, this has to go back to all the members of the healthcare. So not only the physicians, but also the patients have to understand that what is the evidence and how can they manage properly. But also policymakers have to understand that the new results have to be implemented from their side as well. And this has to go back to the healthcare, to the bedside, and this is generating new questions and new results. This model was going very well, and also in 2021, using this translational medicine cycle, a publication in Nature Medicine proved that this cycle is working. We could see that not only regarding the clinical outcomes is beneficial to follow this. We analyzed the model in patients with acute pancreatitis, and we could see the decrease in severity, but we could also see that it can result in a great benefit in the academia, in the number of publications and total impact factor citations, so all the scientometry that we can achieve, but also it can result in patient education and so on. So it can influence the whole field of the healthcare. Also, the healthcare benefits are very visible. One of our students in the program, Kata Illés and her supervisor, when they started to research in otology, they have published a paper about mastid obliteration techniques, and after their publication they could manage to share their results not only on the international level but also here locally, and they could change the treatment strategy in this patient group, but also previous results regarding cystic fibrosis. A team from the Hempel Children's Hospital implemented a new follow-up strategy for these pediatric patients, and with the proper follow-up they could diagnose in a higher percentage the otherwise undiagnosed diabetes, which is very important, of course, we know, because of the possible complications that it can result. From the academic part, of course, it also resulted in great benefits. Basically, this program that you can see here started in 2019 back at the University of Pécs. Back then, we had around 20 students yearly, but luckily, when we started our center in 2021 here at Semmelweis University, we already started with 91 students, and basically during the years we could maintain this number. At the beginning of July, we will have the next interview sessions for the upcoming students, and I'm very happy to say that we almost have 100 students that we will have interviews with, so the numbers are growing and we have more and more students. But not only the number of the students is increasing, we also already have the benefits from this program. You can see here the output basically of our center, the most prestigious publications of our students, for example in JAMA Oncology or Pediatrics, but also in other very recognized journals. And if I'm looking at the number of publications, students, all the members that are here at the center, we can see that it's a very big center. And again, I have to say thank you, because this is, of course, because all the students that are here with us and the supervisors and everyone. If you are looking at the program, we can say that the program is specific because it has a very clear step-by-step process. So basically, in the year one, the students have a very strict schedule. At the beginning, they have weekly regular meetings, weekly regular workshops or e-learning materials that they are using for their research. And starting from the second year, the students are more focusing on their research, not learning new methodologies. And we are also following them through these steps. However, as you can see, we started with 84 students back in 2022. Now, at this phase, we have altogether 68 students. So you can see that we also have a very strict policy. We are very strictly following the minimum requirement during the training. And unfortunately, if somebody is not completing the steps of the minimum requirements, they have to leave the program, because really everybody has to follow the rules and regulations, of course. After this complex exam, hopefully everybody will pass. Of course, there will be the second part of your training, the year 3 and 4, where you will have to finish your second project as well, and finish your PhD thesis as well. Talking further about the numbers, we can see that altogether these students in this year have 139 projects. Still, the biggest number of projects are meta-analysis and systematic reviews. But if we are looking at the quality of the publications, you can see that from the 25 published articles, so 25, yes, you can see that almost 70% of the publications are published in D1 journals. And this is, I think, something that is really proving the quality of the students here in the program, that they are really publishing in the top 10% of the journals. And also the rest of the projects are very well going. Of course, again, as I was mentioning, all the students are here because they have already a submitted paper at least, but some of them have even more. If we are looking at the numbers of or the publications of the current students, not the whole CTM, we can also see that there were greatly recognized publications. I don't want to mention all of them, but of course, again, congratulations for all the students that are on the list as well. And another very specific part of this program is that students can meet worldwide recognized researchers as well, like Nobel laureates and other invited persons as well, which is a great example for all the students, I believe. We are also very happy to recognize the best students in our training, the best of the supervisors, the statisticians as well, but also the students. But of course, science is not only about being in the lab or being at the patient bedside and treating the patient, but it's also about social activities. We also are connecting the students on other sides, like social activities, but not only social activities, but we are also paying attention to organize sport activities, so you are very welcome to join. If you did not until now, then please join our social sport activities as well. We are also having very soon the challenge day. I will immediately show a slide about that. And again, the best thing is that we can invite Nobel laureates to this program. For example, Randy Sheckman was the last one who participated at the previous Semmelweis symposium, and he also gave a very important speech about his research activity. But also the people at the CTM are participating at the Harvard medical trainings, which is jointly organized by the Semmelweis University and the Harvard University, and this way we could achieve even greater results. Basically, when Randy Sheckman was here with us, he was telling that he was wishing there had been an opportunity like this when he was young. So we are very honored that he had such an opinion about our program. And again, as I was mentioning, very soon on the 19th of August, generally at this period of the year, we have the Challenge Day, which is basically a bicycle tour around the Balaton Lake. So everybody is warmly welcome to join us and have this short cycling during one day. It's only 200 kilometers. So please join and be with us in this, on this day of 19th of August. Basically, if you are looking at the program, this whole week is about the complex exam for the students. But it's not only about the exam. We also have distinguished guests invited, and today specifically we also have a PhD defense, which is also very important for the PhD students, since based on the new rules and regulations from the doctoral office at the university, you have to attend at least one PhD defense per semester, but of course this is not a question. So we also have this. Today in the afternoon we will also watch together the Germany-Hungary football match, so you are also invited to join us, and we can watch it together, and everybody can take one side of the team. Furthermore, again, also tomorrow and Friday we have further presentations, and you are invited to stay here with us and listen to these very distinguished guests. Talking about today, about your presentations, about the presentations of the students, the schedule is as follows. So the students have 10 minutes of presentation. Please follow the time limit. If you are over the time limit with half a minute, then the committee members can stop you. And of course, we don't want to have that. So please, please keep this schedule. And the presentations are basically followed by a 20-minute discussion. First of all, from the committee, of course, but also all the students will have to ask at least one question during the day. So please also pay attention to the students, that everybody is asking at least one question from each other. And this is also facilitating the discussion here at the presentations. Basically, and these are the cards that you have to give to the, I think, Fanny, you are collecting it, or? Yeah, all the cards. Okay, thank you very much. And basically, at the end, of course, who is asking more than one question, we are very happy to honor them. And we invented this excellent questionnaire prize, which is not only about getting a certificate, but also you will get a bottle of cold wine that you can consume after the complex exam, of course, not during the day. Thank you very much.